Good day, everyone. My name is Piolo E. Marilia from 2TE2, presenting from Group 1. And I'm here about to talk about severe acute respiratory syndrome, also known as SARS. Content outline. This will be the topics that will be discussed for the next few minutes. For starters, we're going to talk about the background and history, followed by disease overview, epidemiology, clinical presentation, and lastly, public health impact. Here's the sample of SARS. We have here the nucleocapsid protein, membrane glycoprotein, spike protein, envelope protein, and RNA. For the background and history, a coronavirus linked to SARS caused the viral respiratory illness known as severe acute respiratory syndrome. At the end of February 2003, it was discovered for the first time during an outbreak that started in China and spread to 4 different countries. The disease, which is currently referred to as severe acute respiratory syndrome, is brought on by a coronavirus infection and spread quickly around the world after that. The first cases of SARS were reported in November 2002, and the sickness was the cause of the 2002 to 2004 SARS outbreak. At 8,469 cases and a case fatality rate of 11%, SARS was a relatively uncommon disease at the conclusion of the pandemic in June 2003. Since 2004, no instances of SARS-CoV-1 have been reported globally. Disease overview. According to World Health Organization, severe acute respiratory syndrome is a viral respiratory disease caused by a SARS-associated coronavirus. It was first identified at the end of February 2003 during an outbreak that emerged in China and spread to 4 other countries. SARS is an airborne virus and can spread through small droplets of saliva in a similar way to the cold and influenza. It was the first severe and readily transmissible new disease to emerge in the 21st century and showed a clear capacity to spread along the routes of international air travel. SARS can also be spread indirectly via surfaces that have been touched by someone who is infected with the virus. Epidemiology. Present statistics. Globally, as of 6:15 p.m. CET, November 8, 2003, there have been 771,820,937 confirmed cases of COVID-19, including the 6,978,175 deaths reported to World Health Organization. As of November 4, 2023, a total of 13,534,000 13,534,474 and 309 vaccines doses have been administered. For the symptoms. So what are the symptoms? SARS can be difficult to recognize in children because it mimics other respiratory diseases, such as influenza. It generally begins with a fever higher than 100.4 degrees Fahrenheit or 38 degrees Celsius and progresses to include one or more of the following symptoms: headache, overall feeling of discomfort, body aches and chills, sore throat, cough, pneumonia, difficulty breathing, shortness of breath, hypoxia, and diarrhea. How severe is it, and what are the possible complications? SARS can range in severity, and its symptoms are similar to those of other respiratory illness. Common symptoms include fever, chills, muscle aches, cough, and difficulty breathing. In severe cases, SARS can lead to pneumonia, which can be life-threatening, especially in older adults and those with underlying health conditions. Many people with SARS develop pneumonia, and breathing problems can become so severe that a mechanical respiratory is needed. SARS is fatal in some cases, often due to respiratory failure. Other possible complications include heart and liver failure. People older than 60, especially those with underlying conditions such as diabetes or hepatitis, are at the highest risk of serious complications. Now, how is it diagnosed? SARS-CoV spreads from one person to another, mainly through close contact with someone who is infected with SARS. When a person with SARS coughs or sneezes without covering his or her mouth, respiratory droplets containing living virus can spray up to 3 feet and invade the mucous membranes of another person. People in close contact with someone with SARS are at most risk, which means they live or work with someone with SARS or have direct contact with the person through kissing, hugging, or sharing eating utensils. How can the disease be treated and prevented? Treatment for SARS involves supportive care, such as hospitalization, oxygen therapy, and mechanical ventilations for severe cases. Antibiotics may be prescribed if there's a bacterial infection alongside SARS. No specific antiviral medication exists, but researchers are exploring broad spectrum antiviral drugs for potential effectiveness. The use of corticosteroids is debated, which concerns about their impact on viral replication, though they may not be considered in severe cases. To prevent the virus spread, sorry, to prevent the virus spread, infected individuals should be isolated and close contacts monitored through quarantine. Important practices include regular hand washing, covering the mouth when coughing, and using protective gear like masks for healthcare workers. Travel restrictions and screenings may be enforced during outbreaks. Public health agencies monitor trace contacts and educate the public. Although there was no specific SARS vaccine during the outbreak, ongoing research benefits coronavirus vaccine development due to the experience with the SARS. Public health impact. Severe acute respiratory syndrome started its outbreak in 2003, socially and economically impacting people across nations. SARS had a considerable impact, especially in the country of origin, China. Aside from that, since the disease was new, no previous information was present. People were clueless about the illness. Along with the spread of it, multiple rumors spread social panic, which led people to believe and panic purchase antiviral drugs when they were told that they could prevent and control the disease. The spread of the disease took a toll on the economy. Due to the fear of contracting the disease, people from China avoid public places. travel, and face-to-face contact. In addition, schools are closed in places like Hong Kong, Singapore, and other areas of China. Meetings and conventions are canceled, and dining establishments and retail centers are in decline. Asian countries lost around 12 to 18 billion dollars due to a lack of people traveling and tourism and retail in these countries. In addition, due to the spread of the disease, families cut back on their consumption of food, clothing, vacation, and, and entertainment, and hotel occupancy rates precipitously dropped. On the other hand, around half the percentage of the families of the SARS patients experienced depression and were stigmatized due to the negative information about the disease. So, here are our members from Group 1. We have Bea Natsumi Divina Gracia, who worked on the disease overview. Rispa Domingo worked the background and history. And yours truly, Piolo Imarilia, who's presenting now. We also have Aliana Motos for the content, clinical presentation, and PowerPoint. Nina Pakinggan for the public health, and Lawrence Ronquillo for the epidemiology. Once again, we are Group 1. Thank you for listening. Have a blessed day.